to recognize not only the excellence in science and the importance of all that which we've heard this morning and will for the next day and a half hear about, but also for, in addition to that scientific prowess, something that all of you know is absolutely critical, and that's the healing, touching hand of a caring health giver. So it was that this prize, the Pinedo Prize, was conceived in that duality. Excellence in science and prosecution of that method, but also compassionate care of the patient with the disease and recognizing their family as well. So it was that that prize, the Pinedo Prize, was created. And this year, the 5th year of the Pinedo Prize Award is now, we're very honored to say, a part of the responsibility of the Society for Translational Oncology, for it has fallen to our remit, that is the Society's remit, to conduct it hereafter. Since the prize's conception, it was very easy to see the person who should be first entrusted as the first Pinedo Prize recipient, and that is none other than our host and the editor-in-chief of the journal, The Oncologist. All of you who know Bruce, love Bruce. You all know that what you see in Bruce is the real deal. And those of you who have had the honor to refer a patient to him or to be seeking his consultation about one of your patients, you know the depth of this person in that very special way that made it very easy for the nominating committee to award the first Pinedo Prize to Bruce A. Chabner. For in fact, it sent a message that Bob Pinedo himself created for the life that he lives, the care of patients that he provides, and the significance of his message to all of those who he has trained. So it was in keeping with that great tradition that the prize winner became Bruce Chabner. I'm delighted to ask Bruce now to come to the podium.
Well, the reason I'm hunched over here is not because of old age. I tried to run yesterday, and it's not a good thing to do after a 3-month layoff because I have back spasms. Actually, I may have been related to carrying the Pinedo hand, the statue around. Anyway, I thought I would just briefly tell you something about my friendship with Bob. It began in 1974, I believe it was, at the International Cancer Congress in Florence, where I got a message that somebody wanted to find me, and this young man from Holland came looking for me in I think one of the piazzas there, and he was in a rush, and I said, this guy's got an amazing amount of energy. I don't know if I can cope with this. And he said that he wanted to talk to me about his working at NIH. He had made an arrangement with Paul Carbone to work in his lab on bone marrow stem cells, and Paul had just then decided to leave to go to the University of Wisconsin, and Bob needed a home. So I took Bob, not really fully appreciating what a whirlwind it was going to be. It was I guess Bob was with us about 1 year and 2 months, and it was just, 24 hours a day, 7 days a week. He accomplished a great deal. Went home knowing a lot about oncology, had met his future wife, and he also carried a mouse in his pocket when he went back to Holland, and he somehow got through customs. It was a tumor-bearing mouse, I think, and he wanted the cell line, and we had no easy solution, so we just put it in his pocket. God knows what his suit looked like afterward, but he's a determined fellow. So he came back to Holland, and over the next decade or two, really established the premier clinical cancer center in Holland, and it was a service that was associated with the research interest that Bob carried forth as well, and it was really a symbol of I think of the best of American oncology carried to Europe, and now as one of the prominent centers in Europe. I was particularly honored to receive this award. Of course, the selection panel were all trainees of mine, so it was a done deal, wasn't it, Bob? But today we have the pleasure of introducing one of my trainees, Patty Johnson from Belfast, who is the chair of the selection committee for this year's award. And I think that we all know who it is, but we should recognize it and hear about this person.
Thanks, Bruce. So it was an honor for me when I got a call about 5 years ago from Bob asking me to actually take on the chairmanship of the selection committee, and I have to say it's something that we've taken great care with, starting, Bruce, with you, and I think Joe is still here as well, so we have two of the previous awardees here. Just a little bit about the prize. The prize is awarded on an annual basis by the Society for Translational Oncology to an individual who has produced notable advances in cancer patient care or translational research and who is a practicing physician, particularly entrusted with compassionate care for patients. It's actually given in Bob's name in recognition of his pioneering work in oncology, particularly in Europe, and also his outstanding contribution and distinction as a physician and oncologist. Any of us who have tried to follow in Bob's boots and Bob's footsteps actually have had very large shoes to fill, particularly within the European framework. But I know that our awardee today, and indeed myself, have actually looked to Bob for very careful advice in how we go about building meaning and credible cancer centres in Europe. And for that, I personally am very grateful to Bob. Well, our latest recipient it's no secret who it is. It's Dr. Jose Bazalga, who's now metastasized rather than migrated maybe to MGH. And Jose is well known to, I'm sure, everybody in the room. He's highly respected for his contributions to translational medicine and translational research, specifically to the translational knowledge that he has developed and informed around the EGFR inhibitors, in particular EGFR antibodies, and their development both against EGFR1 and HER2. His contributions include the demonstration of the effect of EGFR antibodies, and also its impact on signal transduction, both in tumor tissue as well as normal tissue, in both animal models and, of course, particularly in the clinical trial setting and in the treatment of patients. His development of critical biomarker studies in relationship to the effect of these antibodies have been extremely important in guiding the field and in the development of these drugs. His career exemplifies, and our committee was unanimous in this, really exemplifies both aspects desired of this prize, including groundbreaking translational research and excellence as a hands-on, caring and compassionate physician and clinician. And Jose is definitely all of those. He very much travels in the tradition that Bob has set for us, and I know that he too, like myself, has gained hugely from Bob's input and experience. He's widely recognized by all of us in this room as an international translational research leader in this new age of biologic therapy. So on behalf of the Society and on behalf of my members of my selection committee and also on behalf of the previous recipients of this very important prize, it's an honor to ask him to come up here and for the hand to be presented by Bob Pinedo.
It's an honor to hand you by hand. And it's also an honor to give you the prize. Thank you so much. thank the previous speakers for all they have done, and I'm extremely proud that this is the prize winner of today. Jose, great. I wish you a lot of success in Boston.
So, Jose, if I can invite you to give the Pinedo Award lecture.
So thank you so much, Patty, and thank you so much, Bob. We all have, those of us who are in drug development, we all have Bob Pinedo stories to tell. And I think that clearly, when I went back to Europe, Bob had what was the premier site for early clinical trial development. And basically your effort at the university was a real hub of people from multiple sites around the world working there. And shortly after I arrived in Europe, I began to ask myself, am I going to make it there? It's so complex, it's so difficult. So everybody I asked, what shall I do? They all said, go and talk to Bob. So I went to talk to Bob. And I remember we had a number of interactions, and you were extremely insightful. And that's interesting because in Europe, as you know, the countries are different. So a person that is in Holland giving advice on how to make it in Spain is not that easy, but he did. And over the years, I've always been fortunate by your advice and by your guidance. And actually, we all have copied a lot of what you did in all the centers that are doing phase 1 clinical development. So I'm very pleased and very honored by having this award.